Hey, I'm Jeremy. I'm going to be your nurse today. We're going to be doing a neurological assessment on you. I'm going to wash my hands first. Can you tell me your name and date of birth?
Austin Andrew McDonald. I was born on March 22nd, 1996.
Okay, very good. I'm just going to start with a few questions.
Okay.
Any loss of consciousness or fainting?
No.
Any convulsions or trauma?
No.
Any numbness or tingling?
No.
Tics or tremors?
No.
Okay. What about limping or paralysis?
No.
Any loss of movement? Any involuntary muscle movement? Any loss of memory
No.
or mood swings?
No.
Okay. Any changes to any of your senses? So smell, taste, vision, hearing, touch?
No.
Okay. So looking at you and talking with you, I can tell that you are alert, you're responsive, and you're interacting well. You're oriented to your person. You've already told me your name. Can you tell me where you are?
I'm at Chattanooga State.
Okay. So you're oriented to place. Can you tell me what day it is?
Today is Thursday, July 16th.
Okay. So you're oriented to time. Now, are you experiencing any pain or discomfort?
No.
Okay. Very good. So again, talking with you, I can tell that you are articulating well. You have good articulation. You're speaking clearly, so good clarity. You're speaking in a good, appropriate volume, and you're comprehending what I'm saying.
Yes.
So all of those things are good. So now we're going to move on to your cranial nerve assessment.
Okay.
So cranial nerve 1 is your olfactory. So I'm going to have you pull your mask down for just a moment. Close your eyes. Close one there. There you go. And tell me what you smell.
Alcohol.
Okay, now close the other and tell me what you smell.
Alcohol.
Okay, perfect. Now you can open your eyes. So cranial nerve 2 is your optic nerve. So we're going to do the Rosenbaum test to test your visual acuity. So I'm going to have you read on there, put it at 14 inches from your eyes, and read the lowest, close one eye and read the smallest you can read.
426,739.
Okay, now close your other eye and read that same line backwards.
937,624.
All right, perfect. So you assessed at a 14 out of 14 there. So you're good. Cranial nerves 3, 4, and 6 are assessed together. So this is your oculomotor, your trochlear, and your abducens. So what I'm going to do first is I'm going to just check your extraocular muscles, movements, and that sort of thing. So I'm just going to have you follow my pen light. I'm going to perform the H test, okay? All right, very good. Now I'm going to check your pupils for perla, so equal, reactive to light, accommodating. All right. All right, so your pupils dilate as expected. Now, what I'm gonna have you do is I'm gonna have you look at my pen light and then look at the wall behind me. Okay, very good. So your pupils dilate as expected, showing accommodation. So we're good there. Cranial nerve 5 is your trigeminal nerve. So I'm gonna have you pull your mask down once again and close your eyes. And I'm gonna tell you, I'm gonna lightly touch you and I want you to tell me when you feel it, okay?
Yeah. Yeah. Yeah.
All right, very good. Okay, so you can pull your mask up for a minute. Actually, yeah, pull it back down for a minute if you don't mind.
I apologize.
That's okay. So cranial nerve 7 is your facial nerve. So I'm gonna have you do a couple of things. So smile for me. All right, frown, puff your cheeks out. Okay, all very good and all very symmetrical. So we're good there. Okay. Now I'm going to, you can pull your mask up briefly. Now I'm going to assess cranial nerve 8, which is your auditory. So I'm going to come behind you and perform the whisper test. So if you will close your left ear and repeat what I tell you.
I like ice cream.
Now close your right ear.
I like pizza.
All right, very good. Now I'm going to assess cranial nerve 9, which is your glossopharyngeal. Normally I would use a tongue depressor and check your gag reflex, but I can look at you, I can tell you're swallowing, you're talking, so your gag reflex is there, so we're all good there. Now I'm going to check your vagus nerve. So what I'm going to do is have you pull your mask down once again, and I'm going to have you open up and say ah, and I'm going to look that your uvula rises as expected. Okay, and it does. So we're good there. Now I'm going to check cranial nerve 11, which is your spinal accessory. So I'm going to put my hands on your shoulders, and I want you to shrug your shoulders against the resistance of my hands. Okay, very good. Now we're going to check cranial nerve 12. So pull the mask down one more time, and stick your tongue out for me. Okay, and move it side to side. Okay, very good, perfect. So now we're going to assess your balance and your cerebellar function. So if you don't mind standing up for me, we're going to perform the Romberg test. So I'm just going to have you close your eyes and stand there for a few seconds, and I'm going to support you in case there is any swaying. Okay, so you can stop. So normally I would assess that for 30 seconds. For the sake of brevity, I'm just going to assess it for a few seconds. There was no swaying, so your balance is good. Now I'm going to have you stand up on one foot at a time and assess your balance for that. Okay, you can put it back down and do the other. Perfect. All right, very good. So now I'm going to check your coordination, and actually I guess I don't need that yet. So I'm going to check your coordination. So what I'm going to do, and you can actually sit on the bed for this, I am going to have you pronate and supinate your hands very quickly like this, okay? So do that for me. Okay, so you have good coordination. Now, and you can stop, okay? Now I'm gonna have you bring your right shin to your left knee and then kind of just roll it down your leg. Okay, and it does not pop up, so we're good there. Now do it with the left knee. Okay, very good. Now we're gonna test your grip and your strength. So I'm gonna put my hands, and I want you to just grip my hands. Okay, perfect. You can let go. So you have a 5 out of 5 grip and equality in both hands. Now I'm going to have you try to pull my hands into your chest. Okay. Now I'm gonna have you try to push my hands out. Okay, perfect. Now let's do the same thing down low on your lower extremities. So what I'm going to do is I'm going to put my hand on the front of your leg, and I want you to try to push out, and then I'm going to do it on the back of your leg and have you try to pull in, okay? Okay? So 5 out of 5 strength there, 5 out of 5 strength there. Now let's do it on the other side. Okay? All right, very good. Okay, so now we're gonna just test the sensory of your upper and lower extremities. So what I'm gonna do is I'm gonna have you close your eyes, and I'm going to lightly touch you. And actually, you know what, before you do that, let's pull the legs up on your pants just to your knees or so. Yeah, that's perfect. Okay, so I'm going to have you close your eyes, and I'm going to touch you with something light a few different places. I just want you to tell me where I'm touching you when you feel it, okay?
Left wrist. Left bicep.
Okay.
Right bicep. Right forearm.
Okay.
Right shin. Left shin. Left knee. Right knee.
Okay. Very good. All right. So now we're going to perform the Glasgow Coma scale. So the first one is your eye opening. So you have spontaneous eye opening, so a 4 there. Your motor response, you've obeyed all my commands, which is a 6. And your verbal response is oriented, 5. You converse and you're oriented, which gives you a score of 15, which is the highest you can get. So that's good. All right. Now I'm going to check for any stroke, any signs of stroke. So you have no facial drooping. You haven't slurred your speech at all. And now if you will put your arms out, okay. And are your arms feel weak at all when you?
No.
Okay. And they are even. So we're good there. You can put your arms down. Okay, now, so that concludes my neurological assessment, and I'm going to wash my hands, and I'm done.